Okay, we'll get started and welcome everyone to this webinar on the design and implementation of impact teams. And I'm Walter Proper, the Executive Director of IPHL and the moderator for this discussion. And I think maybe we'll introduce our different panelists next. And we have joining us today is Judith Anyona. And as you can see, she's a senior advisor at inSupply Health Limited in Kenya with 15 years of experience. She's actually been with JSI and then inSupply for the last 4 years. We have Matiko Machagge, and he's the country team leader, as you can see, in inSupply in Tanzania with over 15 years experience in supply chain, managing supply chains and impact teams in Tanzania. He is also a pharmacist by profession and has been with JSI and inSupply for over 12 years. And then we have Tintin Juhartini from Indonesia, and she's a national program manager for JHU on the Choice Project. And she's responsible for the supply chain component. She has 20 years experience in logistics and supply chain. And she actually started with JSI on the original My Choice project in Indonesia and has continued on with JHU. And welcome to all of you, and thank you panelists for being here. We, as we proceed with the panel, then please make sure that you can put your questions in the Q&A. And as it says, if there's time permits, we'll address all the questions by the end of the discussion. If any questions are not addressed, we will put them on the IPHL listserv for the members of IPHL. And of course, if you're not a member of IPHL, we encourage you to actually become a member. So let's jump in with our first question. I think, what is the impact team approach and why is it important? And I think we'll start with Matiko from Tanzania to answer that question.
Yeah, thanks so much, Proper, and welcome everyone. So impact, the word itself, it stands for information mobilized for performance analysis and continuous transformation. This is a people-centered, data-driven approach for continuous performance improvement, and in this case, is supply chain. Why is it important? This approach, it provides a practical way of really using data for performance improvement and empowers healthcare workers to cultivate that culture of data use. It's a proven approach that's originated from quality improvement team, but modified through operational research that JSI did back in 2008 in several countries where it was implementing projects.
Thank you, Matiko. So let's go to our next question. So what were your objectives when designing the impact teams? You know, what did you want to achieve? Let's go to Judy in Kenya for that question.
Thank you, Walter. So the objectives for introducing impact team, one was to provide a structured approach for data review where staff would be motivated to make changes, also coming up with a culture and culture of problem solving and improving performance. And thirdly, creating dynamic leaders who are empowered to make decisions from database decisions and being change agents to ensure that those decisions are actually implemented. In Kenya, the health system is quite evolved. From the national system, you go down to the county, to the sub-county, to the facility level and community level. So inSupply has implemented this impact teams at all those levels. Back to you.
Thank you, Judy. So let's go to Indonesia and Tintin to talk about your system a little bit for how the impact teams worked in the Indonesia system.
Okay, thank you, Walter. In Indonesia, we have the same, we have a similar objective like Kenya, but I just want to add one objective that is the communication, improving the communication and the collaboration among the team members, because in Indonesia, supply chains involves several divisions. I think that's all. Thank you.
And you worked at these levels in your system, right?
The impact team is built in the province and district levels only, and then we also have like the multi-level impact team, province and district team.
Okay, let's go to Matiko now and to talk about the Tanzania impact team, how that worked.
Yeah, thanks, Walter. So in Tanzania, in terms of structure, health system is still centralized. So we have, in terms of supply chain, we have two levels, MSD Central, which also counts with zones and then facilities. But impact teams, we have them at a national level, regional level, district level, and the facility level. And the overall objective were to promote, of course, availability of data, cultivate the data use culture, and also promote generation of quality data, because we believe through use of data, the data originator improves the quality of the data that they are submitting and sharing.
Okay, thank you. So let's look at our next question. So what is the process for designing impact teams? And Judy in Kenya, maybe you can take that question.
Yes, thank you. So the impact teams approach was developed through a human-centered design process, which informed the implementation, the first phase of implementation, and also it helped to improve the second phase of implementation. After getting the results from the human-centered design, they helped us to identify what are the right levels of implementation of impact teams, what is the team configuration within the impact teams, and also what would motivate the teams to be able to implement this approach. And thereafter, we started with engagement with the leaders. And we found out that engagement with the leaders was key to the success of impact teams, mainly because of for creating sustainability and building momentum within the impact teams. After that, we came up with, we started off with a design workshop where the leaders had identified who should be the key players within the impact teams. And we engaged them in our design workshop. And the purpose of the design workshop was to create a common vision, a goal, come up with targets and key performance indicators that the impact teams will be working through. Then the teams were formed at this point, and we conducted a role profile assessment whereby inSupply identified what are the key personas that are required to form the impact teams. And the assessment was just to identify what capacities and skills are required within these teams. After that, we came up with a workshop where we were training the team members on how to actually implement the impact team approach. And during the training, we were looking at training the team members on the indicator tracking tool. How will they track their performance indicators? Also on the impact team processes, looking at action planning, how do they do problem solving, how do they recognize good performance, and so on. And also issues to do with team effectiveness, because these are teams from multidisciplinary sectors, and they're coming together, so we need to work on their effectiveness. Thereafter is when the impact team meetings start to happen. And when the impact teams meetings are happening, they review data on a regular basis, they conduct problem solving on the issues they identify, and also they plan to rectify these actions, the challenges that they are facing. And they also create a recognition plan that where there's good performance, how can they recognize each and every team member to motivate them to do better next time. So that is how we designed the impact teams approach.
Excellent. Okay, let's go to our next question. And so how did you decide on the composition of the teams, and how long did it actually take to form these teams? Let's go to Tanzania and Matiko for that response.
Yeah, thanks, Walter. So the team composition were decided during the design workshop where we had all stakeholders, so Ministry of Health, PO RAG, and implementing partners and other stakeholders. The team composition comprised of commodity managers, and in this case, I'm talking of pharmacists who are in charge of health commodities, and the laboratory technologists who oversee laboratory supplies and reagents, and other program coordinators such as malaria coordinators, vaccine coordinators, reproductive and child health, etc., and focal people for health management information system and the quality improvement team. So all these people are either at a regional or district level, and at facility level we had members from facility. And in terms of sites, from regional level up to district level impact teams, there are 11 core members, and hospitals have 8 core members, and lower level facilities like health centers have 4 core members, and of course the option of co-opting any other member within the hospital or the council level to be part of that particular meeting. In terms of from that design to implementation, it took us almost 3 months, 3 to 4 months, because when the design was completed, we developed a standard operating procedures manual, we developed a training material to orient the team, and then the team now they can start implementing the approach.
Thank you. So our next question, you've got your strategy, you worked on putting the teams together, training the teams, then the question comes up, what motivates these teams to implement this approach? And let's go to Indonesia and Tintin for that answer.
Okay, thank you. The motivation came when they can see their performance and discuss among the team members. Previously, they never known the achievement, and also because the data was not visible and every division carry out the role and responsibility without coordination and collaboration. Now they have the visibility to evaluate the achievement and discuss it among team member, and also follow up the action need to be done, and to improve the performance. And also the recognition came from the higher level, become the motivation also, because it's create the competition among the districts to improve their performance, since the tools also visible for them to see others' performance. And then, for example, higher level will acknowledge them in the big meeting with all of the district in that province. So that's make them proud of it. And then, as you seen in the slide, this is the testimony came from one of our districts intervention, and then their interest in trying to solve the problem, and then because they know how far they are doing. So that's in our country experience.
Great, thank you. So obviously with all this, great in terms of getting the motivation from the top, from the people doing the work and seeing the results of their work. And there were challenges still with all of this. So let's go to the next question. So what challenges did you face? And I think we'll go to Tanzania and Matiko to answer that.
Yeah, thanks, Walter. So some of the challenges that we encountered were, of course, the teams to adhere to meeting schedules. The regional and district teams, by design, they're supposed to meet on a quarterly basis, and facility level impact teams meet monthly, but that's not the case all the time. So you find they have other competing priorities, so they miss their schedule. The other is that we have not yet trained the national level impact team, so it makes it a bit of a challenge in monitoring and supporting these other teams. And some of the action plans that the impact teams developed, they are not able to implement all the actions due to resource constraints, but we are working with other partners here, and they've been very supportive to implement some of the other, but not everything. And the other that we noted when we did some of the support supervision is we found some very good stories within impact teams, what they have accomplished, what they have resolved, but they are not documenting this and share this learning. So we've been encouraging them and advocating that so that the good stories and achievement that they have can be shared to everyone and to the global community.
Great. So as you address these challenges, I guess the next question is, what recommendations do you have for other countries who want to implement this approach? And let's go to Judy in Kenya for that.
Yeah, so some of the recommendations I would make when you're implementing impact teams, one is to get buy-in from the leadership. Building champions within the leaders is likely to help you create the momentum and also sustain the approach. Secondly, the team effectiveness, we found that to be very important. The team needs to gel and be able to work together. We also need to focus on what's the right level of implementing the impact teams. So and for us, the right level was closer to where action is taking place. So the sub-county level was the best level for us to implement, the facility level and the community level. And the higher levels would offer supervision for the rest of the impact teams. And finally, building the technical skills within the teams. You want these teams to be independent, to be able to organize their own meetings, to be able to review their own data. So building those skills to organize the meetings, organize their notes, their action plans, implement those action plans, and also build their technical skills in supply chain or any other technical area you want to build the impact teams in. Yeah.
Okay, thanks. And I think, as Judy would agree, that so many other countries had the similar experience to the Kenya Impact Team. So let's look now. So what are those key performance indicators that you use to measure success, and what were the outcomes? Now, again, we're going to have another webinar that talks more about evaluation of impact of what these impact teams come, but let's look now at some of what are those key indicators and some of the outcomes. And let's go to Tanzania and Matiko to answer.
Thanks, Walter. During the design, the team, the stakeholders agreed on a vision to ensure commodity availability at service delivery points. So most of the indicators picked were supply chain indicators. One is talking about commodity availability, so focusing on stock status and stock outs, and the other was on data quality. So these are some of the initial results we have seen. So in terms of stock out rates, there was a reduction up to 5% when we started implementing this, but later on there was not much improvement, and it was largely due to other reasons beyond what impact team can do. And in terms of data quality, this has improved significantly. We track the percent of items reported that are managed by facilities, because by design, facilities should report everything that they are managing. But we realized through data use, they were not reporting everything that they have. So through this and the impact team that they have been implementing, this has improved significantly up to 95%. So those are some of the results initially, but we can share some of the things, including the capacity building, the change in behavior in terms of the data use culture that has been calculated within the teams, and lights during the next session.
Thanks, Matiko. Let's go to Indonesia and look at some of theirs, Tintin.
Okay. Thank you, Walter. Indonesia has also similar KPI with Tanzania in the product availability and also the LMIS, the reporting rate. But we also have another KPI is that distribution. We also monitor the distribution and also storage, whether is it compliance with the guidelines. At using in the result here in the slide that our main implementation is start in April 18 until December 19. That shows that significant improvement of stock out rate. we can reduce the stock out rate significantly. So we compare it in the with the project non-project area, and then as you've seen also in the 2020, we start the digitalization implementation nationally, and that's why the trend of the non-My Choice project also has also reduced the stock out rates. And with this data, everyone that involves in this uh, impact team will evaluate, and also they will monitor the distribution system, whether it can be impacting the stock out rate. When they done it completely, routinely as a schedule, then they can achieve it. Thank you.
Great, Tintin. So let's now go to Kenya and Julie.
So for Kenya, the indicators are more or less the same. The only difference is we are also capturing the absolute percentage difference, looking at the beginning ending balance to help us look at data discrepancy issues. We are also tracking issues to do with vaccine coverage and also vaccine wastage rate. So in the graph that you can see there, we saw reduction in one of the sub-counties in the stock out rates, and also improvement in vaccine coverage rate in one of the sub-counties. And this has been seen across many of the impact teams where we are implementing, and we will be doing, as we approach the end of the project, we will also be looking at what are the best practices that we can pull from the impact teams. Thank you.
Excellent. And as I said, we will be having a follow-on webinar sometime in the future, which will get to more of the results looking at the KPIs. Thank you very much, panelists. So I think at this point, actually, we have a chance to do our questions. You do see the IPHL because this is recorded and will be on our website and on a YouTube link as well. We'll be putting it out on the listserv. So again, if you're not a member, please join. But this is great. We have some time for some questions. So I'm going to go to the Q&A question from my good friend Gamario Simpungwe. And it's to Judith. How do impact team members meet and interact in the wake of COVID-19 and limited funding from the central government?
Thanks, Gamariel, for that question. In Kenya, actually, COVID has taught us quite a lot of things. We have evolved from having physical meetings to having virtual meetings for our impact teams. So we have like 1 hour agenda, and the teams all join virtually. Where possible, some of them have physical meeting, but they do that with all the cautions taken into consideration, including social distancing and having well-distanced spaces where they can have their meetings. Yeah.
Thank you. And then I have another question from Nayari Rasike to all the panelists. So presumably this approach needs buy-in and support from high-level stakeholders. In the Tanzania reporting goes all the way up to the office of the president. What advice would you give to other countries to try and build this kind of political will and support? Do you have impact results you can share the overall benefits of this approach? Let's go to Matiko first, and then we'll have the other panelists also respond to the question. Is the question clear?
Yes, it's clear. And
okay,
thanks for
great.
the question. Yeah, so I totally agree. I think the initial engagement is crucial, and especially in our case, we had those conversations with the Ministry of Health, with the President Office and Regional Administration and local government office, and really show them what's the value impact team can add. I know one of their priority as government and as a country was to ensure community availability. We have quite extensive electronic logistics management information systems with plenty of data. So it was also their interest to see that people can use data to improve community availability. So when we started this and showed them that this is the value that can be obtained through this simple and low-cost approach, it was easier for them to get that buy-in, and from there scaling out to lower level, it was a quick thing because of the structures and because of the authority that higher level have to other team. But again, also even at a lower level, it's not only that the authority push that, but that I mean the aha moment when they see their own data and they see the value, like when they now know their performance and what contributes to that performance, or what challenge that they have, and the solution, which most of the time they have the solution. It really is motivate them to use data and implement this approach.
Great. Tintin, do you would like to add to the answer to this question?
Yes, actually, in our country this has the similar situation, but you know, like what Matiko said, when we can show them the data, look at the performance and the benefit that they will have it, then you know, even not in the faster way, they will, you know, realize that this is the good approach to implement it. And also even, you know, the form of impact team is not like the formal thing that we design it, but at least they insert it in the program meeting in their each level, and then also they know that supply chain should be discussed among the components. So I think that's.
Yeah. And you all had a particular challenge with people transferring, is that correct?
Yes, that's also the challenge that we have it, because the decentralization in the district, so it, you know, allow the local government to transfer people based on their needs. So that's why it's happened frequently.
So that need for both the district and upper levels to be supportive and understand is critical.
Yes.
And Judy, in Kenya?
I think the value of having leadership also is the fact that this is a quality improvement approach. So whenever there is improvement, the recognition that follows, if it's recognized, if the teams are recognized by higher authority, they feel really good and they feel motivated to continue making the changes. Also, the fact that we are focusing on supply chain, it is true that without commodity, you cannot offer the services. So it becomes really an important aspect for the leaders to focus on. And I think finally, when the leaders see data visualized in a way that they can use to make decisions, justify and advocate for improvement of services, they feel really good, and Impact Teams is offering them that opportunity to do that. Thank you.
Excellent. Okay, I don't see any other questions, but if you do have any follow-on questions, you certainly can send them to us, and as IPHL member, you can put it on the listserv, and the panelists will be looking to respond when they need to. Excuse me. So I want to thank all the panelists and for their time and efforts to put this on. I think the Impact Team way of doing things is very interesting and is showing some success. And as I said, we will have a follow-on to this webinar, which will talk more about actual results and how the KPIs have come out. And I think it'll be informative for everyone. So thank you again. Okay. So I want to thank you, all the panelists. I think we're ending exactly on time. So we're skilled logisticians that we are. We've done it. So thank you again, everyone, and have a good evening, afternoon, or morning. Thank you. Bye.
Thank you.
Thank you.
Thank you so much, and bye, everyone.
Thank you, everyone. Bye.